Let's move on then to the next item on the agenda, which is the item on sustainability and transformation plans. We're going to be joined by Joe Lenihan. Joe is the director of the 5-Year Forward View Chief Executive Officers Board, and perhaps we'll ask Jo to say a few words about that before she introduces the paper. Jo, over to you.
Thank you, Malcolm. Yes, complicated job title essentially means that once a month the 6 ALB chief executives come together to oversee and drive forward delivery of the 5-year forward view vision that we set out in 2014. And as part of that, on their behalf, I lead and coordinate the STP process that we set out in the planning guidance, which I think is worth reminding ourselves. That was just December past, where we agreed that we would require from the system a sustainability and transformation plan. So instead of each individual organisation producing an annual plan, we asked people to come together to agree their local footprint and to develop a multi-year plan across a geographical area on behalf of their populations. And that's really something quite new and radical that we've never really done before. So what I wanted to do today was to update the board on our progress on that. We asked each of the footprints to send us in their initial submission to us on April the 15th, and we received all those. And we used those as a basis for a series of conversations we just ran throughout May with 24 of the 44 footprints, and that the point of those conversations was to make sure that we had a shared understanding of the challenges on each patch, that we could identify what the big issues that they need to focus on to move forward and what we as a national team could do to help, and to agree what we'd like to see in their June the 30th submission so we can actually start taking it forward. The day consisted of a panel made up of at least 2 ALB chief executives, so it might be Simon and Jim on one day, or Ian coming from HU and Duncan Selby from another, the regional directors from NHSI and NHS England, and the Chief Executive of the Local Government Association, Mark Lloyd, recognising the absolutely joint way we need to work with local government. And for the footprints, each footprint lead brought along the Chief Executives of the trusts, the account officers of their CCGs, and again the leaders of their local councils. And then we as I say, we had some really helpful conversations. So, I mean, Simon, I'm sure will have observations, as will Richard, as one of the RDs who attended at the North. But my own reflections would be, without exception, everyone welcomed the conversation. Now, people would say that, wouldn't they, with their bosses in the room, thanks for the conversation. But I think genuinely, there were some people who clearly been working for many years on different strategies, and I think they welcomed the STP process as something that would give them pace and momentum, some focus for stuff that they know they want to do. There were other areas that had literally never come together before, and it was the first time they were having a conversation about what was the best thing to do for their population, and again they welcomed the incentive, the encouragement to do what they thought was the right thing. So I think that the energy in the room was genuine. The other reflection, I think that everyone again was at very different starting points. As I've just said, some literally it was the first time they'd come together, whereas others were really polishing up some really well worked plans. And I come back to that because that's key to how we take it forward. We had to keep stressing, I think, the both and message that Simon and Jim were giving, that this is not just about creating a lovely strategy for 2021. It has to bridge back to the here and now, the issues that Simon was talking about for 16-17. It's not difficult to create a strategy, it is hard to connect it with the action we need to do now. So the conversations it's how do we make those two connect in the real world. Workforce came up as a key issue in practically every footprint, particularly the most challenged areas. So we were grateful that for the support HE will offer us there. And I think the last reflection I'd have was both the calibre of the local authority representatives and the collaborative nature. Quite often in the conversations, the energy and the means and the goodwill to take things forward is coming from local authority colleagues. So, and I think that shouldn't be I shouldn't have to observe that, but I think just being honest, it was an issue, and I think that's one that we can really harness our efforts to going forward. And Mark Lloyd, I think, has been an excellent colleague in that respect. So in terms of what next, we've asked for people to make a submission for June the 30th. You may have seen we published guidance last week. Guidance in the sense it was essentially a 2-page letter. We're trying to make it really simple what it is that we want from people. So we set out there that we need each footprint to make sure they have a shared understanding of the challenge, where they're at in terms of the 3 issues, the money, the health and the quality on their patch, to identify the 3 or 5 critical decisions that they need to make if they are to actually tackle those 3 challenges within the indicative allocations we set out for 2021, and to be able to spell out what the anticipated benefits are for their public and their populations in each year, and being clear about what actions are relevant for individual organisations, what they need to do collectively, and what we may need to do nationally to help them, and also to set out their plans then for building consensus and engagement with other partners, patients, public, the voluntary sector, clinicians, crucially, and that should be a key part. Now, having said that, we do recognise that everyone is very much in a different start of this journey. So in that guidance, we did say how much detail you are able to go into on all those things will depend upon, to what extent where you are on your journey. So we do recognise some plans will be more detailed than others, and we are considering now in terms of the July conversations that we have with people, how we sign off will now be a bespoke process. Rather than trying to sign everybody off on the same day, we are considering a more pipeline approach, recognising that those who are most advanced and have a compelling case for change that we think stacks up, they are more likely to get early approval to get on with it. Those who are sort of in the middle or towards the end, they're going to need more support, they may need to do more work, we'll need to work with them to get them over the line. So there'll be phases or waves in terms of how we take that through, with view to weaving and building that into the 17-18 planning process and beyond. But there's a lot more work to be done on that, but that's our current thinking. Which brings me on to the support for footprints. You'll see in the paper I've listed both the national policy directors and the regional directors are doing a lot of work with the footprints to help them not just deliver a plan, but actually to drive the implementation that would take forward the visions that people are setting out. So we have got streams of work in Strand. Is it enough just yet? No. I think we all need to look at how we work individually as ALBs with our regions and how we work collectively amongst ourselves. So again, we're doing work amongst the ALBs in terms of how we best support people on not just producing a plan for June the 30th and beyond, but how do we drive a 5-year programme of change across the system that does set out the 5-year forward vision that we all want to see. So it's just a very quick run through, Chair, in terms of the progress we've made. I just wanted the board to be updated on that, but also to share their observations and recommendations on how we achieve the purpose and maintain the energy and momentum I think we've actually triggered in the system, and not drown ourselves in too much processes. So that's all I wanted to say.
Joe, thank you very much for the introduction. Let me open up for a discussion around the table. Noel.
Joe, it's great progress, and one of the areas which I think we are testing is our ability to pool sovereignty and create what you described as a collaborative process. As some of the STPs go first, and do you think there is a way in which it is possible to transfer the learning from those who have succeeded in creating consensus to those that are struggling to create consensus? In other words, is there a mechanism by which consensus building techniques can be transferred across the system, or is this highly individualistic and situational?
Thanks, Noel. So yes, that's a key question. So we have put the 44 in touch with each other. We've got a social media platform where they can share ideas and experience. As we went round and did the visits, we've connected different people that we think may be useful for each other. And the chief executives now have a monthly telephone conference call with all the 44 together. So we are trying to build them as a system leadership team. and I think share the learning. But I think my personal view that a lot of that is actually about personalities and relationships and trust, and that you need to build that, and that the SDP process is a forcing mechanism. It's a useful tool to actually help build and grow that. I should also add that we've commissioned the leadership board that works for that reports to the 5-year forward review board to develop a whole programme of system leadership and support and tools to help people to do exactly just what you've done, what you've said.
Thank you.
If I just add to that, I'm curious about, well, two things, if I may. The first is what your view is of how they think about other system players, like the not-for-profit sector, because they weren't in the room, so
Yes.
and they're a big player. And the second is the question of evaluation, because we wait to the end of a programme and then evaluate it. And I'm just wondering what the evaluation process is going to be. Is it waiting to the end? Are we doing it? Are we evaluating as we go along? Are we?
On that second one, actually the King's Fund are actually evaluating this process as we go along. So they've picked up 4 footprints, and that was my steer to the King's Fund. It's no point telling us afterwards what we should have done. We need to learn as we go, and I've got a meeting with them next week. So this is action learning, because it is very iterative. We have never done this before. So and so we're keen to sort of build the learning, and with the 44 to feedback and take each point. In terms of the not-for-profit sector, no, they haven't been in the room to date, but I think you're absolutely right, because we're trying to build a change management programme. And I think in some areas, again, it depends where they're at. Where the NHS itself is not yet used to pooling sovereignty, they've got to get those relationships right. And ditto, some are not used to working with local authorities. It's very new to them. Some are much more advanced and have done that. So again, they'll be in different places. We will encourage and steer and show what we think good is. But just be honest about it, I think people are in different places on that.
David and John.
Joe, this is I think absolutely essential for the sustainability of the sector, and for it to be successful, it's highly likely there will be some quite radical change, which gets me to 2 key questions. I think firstly is the capacity and capability, your assessment of the STP areas to manage that change and to implement it. The design is the easy bit, the implementation is the hard bit, and the NHS is not full of huge successes of big structural change as this is. And then the second thing is that a key part of that change process will be taking the local populations with us as we go on the journeys. And I wonder, my experience would be better to start early rather than later doing that. And therefore I wonder if you could just talk a little bit about where we're up to. So change capacity, capability, what we're doing to boost that and bolster it, and then bringing people with us.
Yeah. So I should add that, so it's not my assessment of the capacity. I'm sort of coordinating the process on behalf of all the ALBs, and the chief executives and indeed the regional directors are absolutely key to this. So we don't have a big central team doing this. I think a design principle is that change will be delivered in the regions and the localities. So that is where the capacity needs to be, in a sense. I should, and my very small team should vanish away so we don't perpetuate that dysfunctionality. And so absolutely that is a key part of the assessment, both the assessment of the capacity and capability within each footprints, but not with a view to marking homework, but then the question is, well, what can we do then? How do we do that? And I know some of the national colleagues may want to, you've already given some thought into how you might distribute resource and address that problem both in the regions and localities. So I'm not going into too much detail, but that is top of our list. But also not just assessing it, but what we actually then practically do about it. And I think the pipeline approach will help us manage that, because then it becomes about our job is then to proactively manage people towards being able to come up with a coherent plan. We're not passive recipients of plans, we are proactive partners in supporting people to develop a robust plan. And in terms of local populations, you're absolutely right, that's how you deliver change. I also think that's why local government colleagues will be so key to this, because they are much closer to local populations than we are on a daily basis, and they have a lot of excellent experience in doing this, and their advice to us was exactly the same. The earlier start the conversations, the better. I think we have a few examples around the country of where that has worked and where that has been successful in the past, and we need to draw on those lessons and share those with people. And we've got quite a big programme of work behind the scenes to actually pull that together to enable people to deliver the changes and the benefits that are necessary. But I absolutely agree that that'll be the one thing that actually makes this work or not.
Sorry, it's worth pointing out the Patient and Public Involvement Task Force that myself and Rachel are chairing will need to be working with you on building that
Very good point.
knowledge and giving the board
Thank
line
you.
of sight as to what's actually happening, so your point's critical.
John? Just extending that, John, just a point of clarification. When do these sort of hit the public domain? Do they all come out together, or is it that will each STP issue its report once you've signed off and agreed a sort of strategy? How does that work?
So it comes back to the language gets against it, but when is a plan a plan? So I think until it's agreed, it's work in progress. These are the basis for conversations. So what we've advised people is that they won't be published until they actually are signed off and approved as a plan. There's no point getting people excited or interested in plans if they're never going to come to fruition. So
Right.
it's a fine judgment, so they will be as and when they're agreed locally and nationally that yes, this is what we think we want to do, there's a compelling case for change. That is when we'll share them, when it is an agreed position. And as I said, if we go down the pipeline route, that will be a staggered approach as opposed to a one day.
But you imply there is an encouragement to get it out to the local community so that people can comment and contribute to that.
Absolutely. And remember, all these people, most areas have been working on some sorts of change in some areas, so they should be drawing on the existing insight, the existing engagement. They shouldn't be starting with a blank sheet of paper, we've said to people. They all should be basing their changes on insight and engagement that they already have, and then do more to build and take that forward with people. This should be a dynamic process, not a static sending in a plan that we then publish.
Joe, there's quite a big challenge for us here, obviously. I mean, this is one of the most wide-ranging radical things that we've done. You can envisage this in some of these areas. You're going to end up with one or more effectively accountable care organisations, which requires us to rethink how we do the commissioning and how we develop the funding streams. I mean, how prepared are we to bring in this thinking and to develop this work with those STPs?
I mean, Ian may want to say more on that, but I think that's so. We also chair a working group, a weekly working group of all the ALB policy leads. So what we're doing now is picking up the consequences of the plans. There are issues that we need to look at in terms of the enablers, the support, what it means for commissioners, providers, for the various guidance that we put out. So there's a whole work stream as we start to identify exactly those issues. I don't know if Ian, you want to say a bit more about
Ian,
that.
please.
So I think there's two aspects to that question, Malcolm. So the first is to what extent the STPs as a planning coalition end up clearly then internalising their allocation and agreeing a sum of money, and that goes back to Noel's question around the pooling of sovereignty between different institutions, having a plan that works. We obviously need that for all of the STPs. There's then a second question, within those communities, to what extent we see new care models developing. You mentioned accountable care organisations, whether PACs or MCPs, which may be subsets of those STPs, which will be developed. And within the STP plans, we have a large number of systems that are very interested in developing those.
So I think the point is we have to be ready with the support
Definitely.
package, well thought through,
Yes.
because the worst thing that could happen is that we've launched an initiative of which we're then obstructive because we haven't got our own ducks in a row. So I think on behalf of the board, we probably felt quite wary and cautious about this when we launched it because it is so radical and wide-reaching. What you've given us this morning, I think, is really good assurance, and what I think we're all listening to, responses coming in from across England. And when I met with the chairs of the CCGs at my advisory council, this was the one thing on which there was total agreement that this was the only game in town for them. That the presence of local government colleagues had been positive, challenging, but actually very, very supportive. and thirdly, for many of them, there was a welled up, sort of dammed up sense of enthusiasm and energy to do stuff that they knew that they wanted to do, but they couldn't do in the existing structure. Hence my question about how we help to change the structures to enable, facilitate and promote the desirable benefits that will come from this. So I don't know whether there are other, no there aren't, questions or comments for Joe, but thank you very much. The board will wish to follow this very, very closely. This is a major opportunity for us to change the way in which the NHS provides services to patients.
Excellent, thank you.
Thank you very much.